Good evening, one and all. Welcome all to Vayomanasa Sanjeevani's Webinar Series. Today's topic for the day is age-friendly environment. To talk about this, we have Dr. Girish Rao, and our co-host for today's session is Mrs. Shakuntala Narendra. I welcome Dr. Girish sir and Shakuntala ma'am for today's session. With that, all the Zoom and YouTube participants, welcome to today's session. Introducing Shakuntala ma'am, she is a lay counselor and a special educator for learning disabled children, and also an adolescent counselor and an active volunteer of Vayomanasa Sanjeevani. I request ma'am to address our speaker and introduce him to today's session. On to you, ma'am. Thank you.
Yeah, good afternoon, everyone. On behalf of Vayomanasa Sanjeevani volunteers and Geriatric Head of NIMHANS, Dr. Shivkumar and team, it is indeed a pleasure to welcome and introduce our resource person of the Dr. Girish Rao for our webinar series on the topic age-friendly environment. It is a very brief introduction. Dr. Girish Rao is presently working as Associate Professor of Epidemiology at NIMHANS. After his MBBS, he did his MD in Community Medicine and was a faculty at Ramaya Medical College, and also was an undergraduate and research officer at Kempegowda Institute of Medical Sciences. That is our doctor for the day, and it is a very brief introduction, sir. Welcome you to our webinar, and over to you, sir.
Thank you very much, madam. Well, I thought today's webinar, we should not be getting too much into PowerPoint presentation. I thought we can make it more interactive session. Hence, I thought I requested our project staff and also our MPH student to join me in making this presentation. So, which is why when Shakuntala madam called up in the morning and asking my introduction, I said just my name is good enough, because I would like to request my team to make this presentation and interact. So hence was hesitant. But anyhow, thank you. I would really congratulate you for finding that on the web. Slightly older one, but that nonetheless, thank you very much for that good, kind words what you had.
Thank you, sir.
Well, friends, I think I will not get too much into English language. I will try to make a mix of English and Kannada so that the real interaction comes in. As we say, English should be a better option which we can look at. Am I audible? Is that okay?
Yes, sir. Yes, sir. You're audible.
Okay. Revati, hope you are there. You're able to hear me?
Yes, sir. Yes, I'm able to hear. Yes, sir.
Okay. Is Renuka with you? Renuka, Kirtana, Rehan?
They're all logged in, sir.
They're logged in individually?
Renuka, Dr. Rehan, and Kirtana, they're all logged in, sir.
Okay. Okay. So that's our team. We have a bigger team at NIMHANS, but just because of time constraints, I've looked at the smaller group. My primary objective in that sense, trying to look at what is this dementia-friendly environment which we are looking at, or sorry, age-friendly environment, or rather diabetic-friendly environment. I'm sure all of us recollect some years back, drinking sugarless coffee was something which was considered as though it's a crime. Now everyone have accepted it, which just means to say, over a period of time, as many people start demanding things, it becomes a reality. So if you are saying a friendly community, only when we start demanding things, then it becomes friendly to us. For example, queue or a seat in a bus. Now, most of the times we don't ask for it, and hence it just goes unnoticed. Now, this is where is a whole issue when we are talking about. It's not in terms of, okay, let's look at the other word, community. What is the word community? Any guess? How do you?
Society at large.
Society at large. Anyone else? Precisely. A slight difference in terms of what is being said. Community is nothing but whatever we share in common. That is where communism is something what we all share. So community is what we share. So if at all we are saying that it's an age-friendly community, then we need to be sharing a lot of things. Now, that is where Revati has put together a couple of PowerPoint presentations. I will just open that just to share a couple of things here. Okay. When we look at elderly, this is the only community. You're able to see this?
Yes, sir.
Yes, sir, we are able to see, sir.
When we talk about elderly, only the disease is what we see. Hypertension, diabetes, coronary artery disease, cancer, heart failure, kidney disease, stroke, and now new terminology, osteoporosis. Not that these are not important, but this is not just the only community or common things what we need to think about. Or when we make a formal analysis, this is what we'll say. The common problems encountered, we seem to be talking about the problems, either financial or in terms of emergency responses not being there. Don't know what is a particular disease. We don't know about dementia. There is no physical infrastructure is absent. The socio-economic change which is happening, I'm sure I still remember my grandfather saying that he used to fight, saying that why should I pay 20 paisa for one banana? He said he used to fight with that person. And afterwards, that person would come and say to me, "Illa illa tata idu bade hand tagondidru, neevinna 4 ರೂಪಾಯಿ ಕೊಡಬೇಕು." So things change a lot. Probably we are still, we may be stuck in earlier one, but some things are going faster than what we think is possible. And lastly, also the absence of companionship. But okay, is that all what we are talking about? Is that what elderly mean or old age means? I will just stop here and request Dr. Sonali to share with us what the World Health Organization says about age friendliness, global age friendliness. She'll take about 5 minutes. Sonali is not very conversant with Kannada, and she's still a student learning to do. So please bear with her when she makes the presentation. Yes? Okay. Sonali, over to you. Can you hear her?
No, sir. Hello.
No.
Ma'am, you're on mute.
You're on mute.
Yes.
Good evening, everyone.
Sir, can you mute? Yes. Ma'am, you can go ahead now.
Yeah,
Sir, you have to mute your system.
Yeah,
It will be echoing. Yes. Sir, it's still echoing.
Yeah, correct. Okay, now it should stop. Yeah, can you hear?
Yes, we can hear. Sonali ma'am, you can go ahead.
Go ahead, Dr. Sonali.
Good evening, everyone. Firstly, I would like to introduce myself. My name is Dr. Sonali, and I'm an MPS student in NIMHANS. So I will quickly go through the highlights by WHO towards an age-friendly world. Okay. So Girish sir has already gave a brief introduction that elder age is not only about focusing only on the diseases in the community, but there are several other aspects also which we need to look on. So process of healthy aging argues that all the sectors share a common goal to maintain and build a functional ability. So these are the 5 key domains of functional ability. Number 1 is meet the basic needs. Number 2, learn, grow, and make decisions. Number 3, be mobile. Number 4, build and maintain relationships. And last one is contribute. So these abilities are essential to enable older people to do the things that they value. Together, they enable older people to age safely in a place that is right for them and to continue to develop personally. Although these 5 abilities are treated separately, so they are strongly interconnected. Other highlight is age-friendly cities and communities. So an age-friendly city or community is a good place to grow old. Age-friendly cities and community foster healthy and active aging and thus enable well-being throughout the life. So WHO Global Network of Age-Friendly Cities and Communities was established in the year 2010 to support municipalities that wish to transform these ambitions into reality. So the network seeks to do this by inspiring change and showing what can be done and how it can be done. Number 2, connecting cities and communities worldwide to facilitate the exchange of information and experience, supporting cities and communities to find solutions by providing innovative and evidence-based technical guidance. Age-friendly intervention are responsive to local needs. For example, in New York City, the Department of Transportation's Safe Streets for Senior program has been developed, measures to improve the safety of old pedestrians in particular areas of the city where older people had been involved in accidents that resulted in severe injuries or fatality. Initiatives in other cities have also focused on enhancing mobility by making transportation affordable for and accessible to the older people. Number second one is ability to meet basic needs. United Nations Article 25 of the Universal Declaration of Human Rights said that the most fundamental of abilities is the ability of older people to manage and meet their immediate and future needs to ensure an adequate standard of living. For the right to adequate housing, it said that guaranteeing legal protection of tenure against forced eviction, harassments, and other threats, ensuring habitability, access to safe drinking water, access to ensuring accessibility and usability, for example, by taking into consideration declines in capacity. Then for reducing falls through environmental interventions. In addition to treating health conditions and controlling medication, a range of environmental So they said that by providing education to individual older people to enhance their knowledge and reduce their fear of falling, home visits by health professional to high-risk individuals, information about reducing hazards in home, training of municipal service providers, healthcare workers, and new housing planners, and improvement in the physical environment of the neighborhood. For the health promotion of older people, we can use several messages which I have enlisted here. Some of them are use communication process that rely on heuristic and intuition, make messages more relevant to the older people, trial positive messaging for the older adults, tailor messages to specific older people and manage their emotional distress. Then maintaining the mobility through physical activity, policymakers can create environment that can promote physical activity by addressing barriers to activity and promoting changes that facilitate safe walking, creating community events to promote physical activity, providing some exercise programs to address cardiorespiratory fitness, muscle strength, etc., and promoting counseling intervention in clinical settings. So these are the interventions that contribute to achieve all the 5 fundamental abilities that I have discussed. To meet basic needs, we can ensure transport option for access to basic services, food and healthcare services. To learn, grow, and decide, ensure that frontline transportation operators are trained about the needs of older people and non-discriminatory practices. For mobility, ensure that public transport is accessible to older people and people with disability. To build and maintain relationships, ensure that public transport provides sufficient stops and stations to allow older people to access senior centers, buildings, and to visit their families. And to contribute, ensure that transportation is available to take people to work or volunteer opportunities. So ensuring functional ability in older people is important in addressing population aging. Priorities for action will vary and countries will need to tailor action to their specific context, but improving the older people and their environment is universally achievable. Concentrating on abilities moves the focus from the inputs to outcomes. In doing so, it focuses both on what is important to the older people and agendas of various sectors. Thank you.
Thank you, Dr. Sonali. I think that was a good rush through of all the activities which you listed out. I think one last slide, that the one before the thank you slide, somewhere summarizes the, can you just go back to that slide? The next one. Next. No, last but one slide. Next. No, one way forward. Last one. Okay. See, the key thing what I found was improving the fit between older people and environments is universally achievable. I think that's the way forward what we need to look at. It's not that there are some, what have we paid attention to that is what we need to be looking at. Concentrating on abilities, that is move the focus from inputs to outcomes. It's not just that you make some facility, but what you need to see is how that facility is helping the elderly to move forward. Now that's a key thing. I think these are the two major things which I thought was a very important point which came out of her presentation. Now, which is why I think Revati had put together these slides. Can you stop unsharing? Okay. Revati independently had put together these slides, and then I think that somewhere shows that all of us are talking in the same tone and pitch. Okay, this is what we talked about. Now, this is what is the big issue which most of the time we spend. Saying earlier we had very big families, so there was less and less. Nowadays we have got small families, so we ought to have more and more. Probably more and more is also more and more of problems or more and more of issues which we have not resolved. I think that's where I wanted our project staff and our students to come out and discuss with you. Let me first ask Revati. Revati, what do you think would be a desirable environment for the elderly? I will stop sharing so that you can switch on your video and then we'll be able to see you. What do you think is a good environment for the elderly to be in?
Good evening, sir. Sir,
Revati, we can't hear you.
Now, sir? Hello? Sir, you're able to hear me now?
No, we still can't hear you.
Hello. Yeah, we can hear her, sir, actually. Revati, ma'am, hello.
Okay, while you try to set up your audio, can I ask Rehan or Renuka or Kirtana to come in? Revati, log out and log in again so that you can join from the computer audio. Okay. Rehan, you're there? I could see Dr. Ajit coming in here. Dr. Ajit was our student who is now working with Ministry of Health and Family Welfare, Government of India. Dr. Ajit?
Yes. Am I
Rehan, yes, sir.
Oh, Rehan is saying he is not able to unmute himself.
Yeah, now I'm able to, sir.
Okay. Ajit, we can't hear you.
Sir, am I audible, sir, now?
Yes, yes,
Hello.
sir. Yes, sir, you're audible. Please go ahead, sir.
Oh, there seems to be some
Yeah,
audio
yeah.
issue. Rehan, can you come again? Let's see.
Yes, sir. So can you hear me?
Hello?
Yes, sir, we can hear you. I think
No,
Girish,
I don't think.
Girish sir, I think you have to
Kirtana?
increase your, one second, I'll just.
Hello? Kirtana, Renuka, anyone?
I'm able to hear you, sir.
Hello, Girish sir, are you audible? Hello.
Sir, I can able to hear you, sir.
Okay. Okay, sorry. I had switched off my speaker and that is how
Right.
I couldn't hear. Okay. Revati, over to you, ma.
Yes, sir. Good evening, sir. And good evening, all. So, according to me, a convenient environment for an elderly to live in will be a home first. So, home should be a place where elderly is able to interact with people first. So, that is what I feel. When my grandmother and father were there, they were like, we all lived and we all were like, we used to go out during vacations. And we used to, at the end of the day, we have a lot of interactions going on, and we used to take them out forcefully out for some minimal shoppings and everything. But today I don't see that kind of interaction. So even when we did a community level survey, like even now we are involved into that survey, most of the houses we see elderly living alone. So it's like just husband and wife, and their sons and daughters are somewhere else working. So I feel loneliness, and then those things getting connected to depression. In urban community especially, they don't interact well with the outside world. So that's what I feel. So isolation, loneliness, and less of interaction with people, I think that is one of the reason where elderly lack in their basic care. So, and otherwise, elderly who are sick can have home level facilities, that accommodation that can be maintained well. That is like create a home friendly environment. That is like everywhere you see now is a tiles and tile and marbles that are slippery. So I feel that kind of a setting has to be changed back, so that at least the basic thing, that falls or like at least walking can be done at least at home properly. So that is my one of the opinion that I can tell, sir.
Okay, thank you. Now you use that word one, interaction. What do you mean
Yes,
by interaction? I always feel, my son always says, my mother will always continue to say the same thing. She has told him the 10th time about the same issues when she was in some place or something, or my father or my mother-in-law, whoever it is. Now, what is that interaction which you're talking about?
Sir, interaction is like how my day went today, like how, what I spoke to my friend, like what is that I like today, what I didn't like today. That is what I interacted with my grandparents. And yeah, I do get the same stories, like at your age, I was like this. And see, maybe because of the generation gap, we feel bit like they keep telling the same thing over again and again. But I think over a period of time, we can also understand that, yeah, they're trying to tell us something out of their experience. So it is just like we have to accept it, accept the elderly, accept the changes in elderly, sir.
Can I ask Renuka now to come in? Renuka? Unmute ಮಾಡ್ಕೊಡಿಮ್ಮ.
Hello. Sir, I'm able to hear.
Yeah, I'm able to hear. What is your thought of age-friendly environment?
Actually, ನಾನು ನಮ್ಮ ಪೇರೆಂಟ್ಸ್, ನಮ್ಮ ಗ್ರ್ಯಾಂಡ್ ಪೇರೆಂಟ್ಸ್ ಇದ್ದಾಗ ಅವ್ರ ಜೊತೆ ಅಂದ್ರೆ ರೇವತಿ ಅವ್ರು ಹೇಳಿದಾಗೆ ಸ್ವಲ್ಪ ಎಲ್ಲ ಇಂಟರಾಕ್ಷನ್ ಎಲ್ಲ ಇರ್ತಿತ್ತು ಸರ್. ಅಂದ್ರೆ ಇವಾಗ ಎಲ್ಲಾದ್ರೂ ಹೊರಗಡೆ ಹೋಗೋದಾಗ್ಲಿ ಬರೋದಾಗ್ಲಿ ಅಂದ್ರೆ ನಾವ್ ಏನೇ ಒಂದ್ ಮಾಡ್ಬೇಕು ಅಂತ ಹೇಳಿದ್ರು ಕೆಲವೊಂದವರು ಏನು ಈ ತರ ಮಾಡಿದ್ರೆ ಚೆನ್ನಾಗಿರುತ್ತೆ, ಈ ತರ ಮಾಡಿದ್ರೆ ಚೆನ್ನಾಗಿರುತ್ತೆ ಅಂತ ಎಲ್ಲ ಗೈಡೆನ್ಸ್ ಕೊಡ್ತಾ ಇದ್ರು ಸರ್.
Okay. Is that all the environment we are talking about?
Yes, sir.
Okay. Dr. Rehan, would you like to comment?
Yes, sir. As Revati mentioned earlier, there are a lot of things that leads to have a age-friendly environment, sir. For me, age-friendly environment is having a good prominent signboards. Like if there is like for an elderly walking on for a shopping for daily requirements, there is a need of them to have prominent signboards where it's easily visual for them that there are steps. Then there is a hazard if they go in some places. This is very important for me, sir. That and safety features in our washrooms are very important, because elderly when they use the washrooms, as the safety measures are not kept in mind these days, and more of aesthetics is kept in mind, this hampers a lot, sir, because safety measures like having a rough tile and then having a simple support system to for the elderly to catch and then get up while getting up from the toilet seats, these all go into a very age-friendly environment for me, sir. Also the social withdrawals that these days the elderly are facing, probably because of our generation also, we are ignoring them because of our busy schedules, also lead to a lot of drawbacks. I mean, they withdraw themselves from the environment. We don't take them out, so their social life is hampered because of that, sir. For example, last evening I had gone for a party. I asked my father to accompany. He said, no, I will not come. This has been happening with him since past 2 years, and he is withdrawing.
No, you are a youngster. You will have a lot of things to do. What would my father, if he comes with me to some place, he will just have to sit quietly?
No, sir. I'm calling him to the relative space where he can interact. So I was calling him to the relative space where he can interact, which also stimulates his happy moods.
No, see, that relative where you're taken, I probably will not like to interact with that relative. So many history would be there, so many other things.
No, sir. I mean, there was a bunch of relatives, his own brothers. So they were, I mean, whenever we meet them, they keep giving me all this feedbacks. We were doing this, we were doing that. So my father is trying to withdraw himself now. He says, no, he's worried about his health. He's more conscious that if he goes in the evening, then it hampers his, probably it'll affect him in the future. That's the thought process he has.
Okay. So you think that your father should forget about all that other things and then mix with relatives, mix with friends, and spend some time? Is that what you're saying?
Yes, sir. He needs, sir. Yes, all the elderly, I feel, should spend time with either their, people with whom they feel comfortable, because according to me, it keeps stimulating their brains, sir. The memories keep alive. I mean, we keep the memories alive.
Okay. Can I now ask Shakuntala madam?
Sir, 1 second. Sorry to interrupt. There are some questions here, sir. Like, I'm really liking the way you're interacting with your students, because the youngsters' inputs are becoming more important to us now. Okay. There are some questions, sir. So can we discuss about that? Can we have some interactive sessions on that with your students and yourself, sir?
Sure.
First is, how do climate changes affect the mood of an individual? How to identify them, and when do we have to seek a doctor's advice?
Okay. See, 2-3 things which we need to notice. Particularly, this has come up as a big issue in the Western regions. See, if you look at in the West, where UK, US, one, there is not many people who are there. So people get isolated, number one. Apart from that, there is a longer period of cold season and shorter period of sunshine. Now, this itself makes people be at home and they don't open up. See, this is the weather changes, what we are seeing, or rather the climate, which has prompted people to start looking at saying that, okay, I need to go out of the house or I will become more lonely. I need to interact with others. Now, if you notice, the same thing was witnessed also during the COVID-19 epidemic. Now, we had to stay inside for quite a long period of time. And that is why we could not talk to people. Phone or we were used to going outside. Now that got cut. Now, this sort of changes in our environment possibly has contributed more. I think Kirtana, Revati, all of them were part of the study when we looked at people with dementia. Their dementia status worsened in this short period because initially itself they were at a loss. Now, with no one else to also come to their help, their loss increased. So this is where we need to be understanding that there is evidence. There is evidence that any of the changes in our physical, social, economic environment will make us much more, what I wouldn't say depression, but will take our ability to live. Now, how should we recognize that? One, many a times we somehow try to justify. It is, I'm growing old, as Dr. Rehan was saying, no, this is how I want to be from now on. People tend to resign themselves saying that this is what we will do. Now, that is where is the job of the family members or someone else. When they say something, don't just dismiss them. Please also take their suggestion. Because we now know, suppose the biggest therapy for depression is taking a walk in the morning. If you can't walk fast, so many steps, that is okay. But at least get out of your home, go to the park or go somewhere so that you can walk. Even that fresh air for about 20-30 minutes is very good for people to. Second, as again Revati also was mentioning, and then Renuka was mentioning, interacting with people. That is the social environment which we are looking at. When you said climate change or otherwise, we sort of stop talking to people because of several things. Now we shouldn't, I know there are difficulties. We can't get along with many of us. Even between husband and wife, there'll be a lot of differences. But within children, there will be many. But issue is, at some point of time, we need to find a place, we need to find a way how we can make change. Now, that is where is the whole job of Vayomanasa Sanjeevani and systems like that, so that we build an environment wherein people can come in. They don't need to come regularly. Don't worry if you can't come every day. But at least whenever possible, whenever feasible, whenever convenient, please do go for a walk. Please talk to your friends. Please spend some time with them. It's not just you alone, but there is also the larger society which is there around. Develop a hobby, a new hobby which can be helpful to you. So these are some of the ways which one can recognize and then try to come out of it. Hope I have answered your question for that.
And along with this, they want to know the relationship between atmospheric changes and elderly's temperature resistance. Is there any relationship, sir? Okay. See, what happens as one ages, the skin starts becoming thinner. We do look at the 7 layers, but what happens, the protective layer becomes thin, which is why if you look at elderly, especially during the winter season, we say that you should you should use a moisturizer. You should use a moisturizer as soon as you take your bath, so that that moisture can get into your skin. And it's not just applying only on the hand, the entire body you should be applying. So in that sense, that moisture, less moisture skin
can cause more problems for your skin later or for your health later, because we start scratching it, there comes a boil, then that leads to something else. So we get upset and then we continue to scratch. So instead of going through all that, as soon as you realize it is winter is setting in or the weather is getting cold, please start using a moisturizer so that you will be protecting your skin. This is one. Second, during summer season, most of us need to wear a hat because that strong sun. See, the ideal sun, if you want an exposure, it should be between 7 and 8:39 in the morning. That's the best sun rays what you can get. Anything beyond that, it is too very, the infrared rays are very high, because of which it can burn your skin very badly. In places like Australia and others, which is nearer the equator, they always use a suntan or a sunscreen lotion before they go out. Now, I would advise all the elderly, if they are going out, all the exposed parts, please apply a tan or any other lotion, and wear a hat so that you don't suffer. You suffer because of two things. One is the infrared rays heating up your body. Second, you losing a lot of water in that process. This is the third thing which we should be worried about. Elderly don't take sufficient quantity of water because many of them have got problems with respect to urination. So trying to solve one problem, they'll be creating another problem for themselves. So what I would suggest is, please talk to the doctor, find out how much water or how much liquid they should consume per day, so that the skin is adequately hydrated. Your skin is your first level of protection to entire environment. That is the first layer of protection. If we give up on that layer, then we are inviting trouble for ourselves. Bagal tegidbit banni namge kata kodi anta ನಾವು ಒಂತರ we'll be asking for them. So we shouldn't be doing that. Okay, madam.
Can I call upon the participants who are interested? They can ask some questions to the doctor. We can have a real interactive session. Participants.
Can you want to react to what?
This is Dr. Mahesh from Abu, Rajasthan.
Okay.
Sir, can you brief me about smart home technology, because one of the need for age-friendly environment?
Okay.
And number two is WHO has propagated a message of age-friendly environment.
Correct.
I think NIMHANS should take initiative and work in this field for Karnataka, building age-friendly environment in Karnataka.
Correct. Correct.
If you take initiative, I'll definitely join with you. I'm from Abu, Rajasthan.
Okay. 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 I didn't get your name.
Dr. Mahesh Himadri from Global Hospital Research Center, Abu.
Okay. Okay. I did not want it to be a very formal technical presentation, which is why I wanted it to be more interactive. So several of the things I have skipped deliberately, but just to come back to your point in terms of use of smartphone. Now the smart city concept is
smart homes.
Yeah. Okay. Okay. Smart homes in that sense is becoming a emerging trend if you look at technology per se. But I would like to differ slightly there, saying that let's not look at only technology related. A smart home can be a home which will help the elderly to stay safe, which promotes the interaction. That is smart. I'll give you an example. I think I'll just switch to this slide set, which, as I said earlier, Revati had put in. It just see, many of these things, the carpets at home. Now, this is something I'm not sure how smart or unsmart we have become. The railings which Dr. Rehan was mentioning. What is now possible is many of these technologies are available online, which you can buy without difficulty. All you need to do is spend time, identify that there is a need, and then bring these things to the home. So this could be a very, very straightforward, simple, and immediate way of making your home smart. Because in the bathroom, especially when there is wetness, you should not fall. When you sit on the toilet, you need to have a support. And when you're walking around the house, you should not trip and fall. Now, these three things are immediately possible and doable without much cost or without much effort. Now, this is the second part of an extended home, which I'm talking about. All of us are looking at what can be at the community places. We can look at simple exercises which we can do at home so that your home becomes smart because you are able to do things which you want to do. For example, where will you keep the, I'll just stop sharing here. Where will you keep the dabbas? Where will you keep your telephone? Where will you keep your newspaper? Where will we keep the spectacles? If it's a lady of the household, where will she keep the household articles? Now, these are some things in a traditional home or in a home which we generally don't give attention to. Everything is kept at a height. With age, I think there is also difficulty in terms of people reaching out. And once they reach out, there is also the carotid artery, which gets possibly because of stenosis for some people. There is a difficulty in terms of they will get giddiness. Now, because of which, what could have been easily solved, we have complicated it unnecessarily. So, Doctor, what I would suggest is let's start making these steps which makes our home smart. This is step 2. Step 3 comes in use of a lot of these technology. Now, in terms of our TV now is got both a computer, it is also a time clock, it is also, it serves several purposes. So identifying some of these gadgets which could be there, or for that matter, in terms of locking the household. Now we have got electronic locks which come in. Many of the gadgets come with remote controlled assistance. So bringing in this technology at the 3rd level could be a very good strategy forward when we say a smart home. I'm sure there are several more technologies which would come in. In fact, people are looking at robots which would come in, friendly robots which are at home, who would sort of take things from the refrigerator and then serve things. Those are all things which are coming up. But one other smartness which we can bring into our homes is use of a smartphone, because nowadays phones are a very big companion to us. It apart from helping us talk to people, you can use it to spend a good amount of your time linking up to the world outside. Now, the whole world opens up to you, and that's another way which you could use. A second thing is, I think nowadays smartphones come with a lot more measurements. For example, have I done enough exercise today? Have I eaten something? These are things which we can use in the smartphone itself. Now apps are there which will help us to keep track of a lot of things. We say we'll forget whether we had food, probably even taking medication. Now, there are apps available which will say, okay, as soon as you take your medication, you do a click on this particular button so that you will not take the medication second time. So I would say put this into the 3rd slot. So your home becomes more smarter and your life becomes smarter as you continue with it.
Sir, many thanks for your presentation. Only thing is, you have started from basic things to latest technology. Like this awareness needs to be created among public. Since Master Public Health is being initiated from NIMHANS, even this small subject can be taken as a subject of study for PhD students and MPH.
Yeah, correct. That is why I made Dr. Sonali make this presentation, because she is our MPH student from Delhi. So she wanted to do some work with respect to elderly care, and that's exactly she did her literature search, and that is why she made the presentation. I think this is her first presentation in a public forum. She has done a lot of
like WHO age-friendly environment is doing a lot
Correct.
of work in the field.
Correct.
So you
correct,
should take initiative. You should take initiative
correct.
for all Karnataka.
Sure. Thanks for that
Yeah.
advice and concern and suggestion.
Thank you, sir.
Can I ask you a question? My name is Nagaraj Rao.
Yes, sir.
Can I ask you a question?
Sure, sir.
We have been listening more about some problem of, in Kannada it's called Aralo Moralo or anosognosia. How to avoid this? Because I find it very common, including me, I'm 84, still I'm doing yoga, but still I feel that forgetfulness here and there happens quite often. Can you suggest something here, something to make it, less affected by this?
Okay. Sir, let me start with the first thing. Please forget that you are forgetful. Number one, all of us go through that because brain, just like how our mobile phones or our computer, it can open only certain number of screens at some point, at a point of time. We can do only a certain number of things at some point of time. But what we expect ourselves to do is hundreds of things simultaneously. Now, this is where the problem starts. Now, I am sure we would have faced the same problems at any age, but when at a younger age, it doesn't affect us much. But as we grow older, suddenly these things start affecting us. So let me reassure you, please don't make it that you are alone in the world or it is only related to age. We tend to forget either in whatever age. But having said that, as you said, when we forget certain things, we tend to lose out on many of the aspects of life. Which is why I said the smartphones in that sense is helpful, because you can remember to put down things, or for that matter, a simple keeping a piece of paper with you so that you will know what needs to be done for the day.
I follow that.
Memoir.
I follow that.
Yes, sir. All of us follow that. In fact, our director pulls me up, Girish, you should have submitted this report yesterday. I said, oh, madam, I forgot about it. And then we do it. So all of us go through these phases. Now, I'm deliberately telling this because the forgetfulness which you are talking about, or the dementia, is a separate disease in itself. It's a disorder. Now, for that, it is not just the individual. Individual will not think that they have forgotten. Now, that is not what you have. Now, you know that you have forgotten things. Now, that happens most of the time because we have not given due attention to that particular issue on it. For example, my father-in-law, he is no more. He used to forget his keys. Now, because there were 2 or 3 entrances to the house, he would have forgotten which entrance. As soon as he comes into the house, he used to keep the key in one place. Now, when going back, he would say, where did I keep my key? The issue there is you trace your way back and then find out how you came in, and immediately you would find the key. So I'm sure many of us find some or the other mechanisms to see that we remember what we should not be forgetting. But having said that, please take it from me. It has been told, forgetting is good. Many things we should forget and then live forward. But I know what you are trying to say. I understand what difficulties we can face. Let's develop some our own ways of how we can overcome these things. As you said, keeping a piece of paper is one. If someone is comfortable with a phone, to-do lists are there, and then you can stick something on the phone, or you can use many methods, using a kerchief and then tying a knot. Use your strategy. But first of all, please don't consider yourself to be diseased because you forget things. All of us forget things.
That is also mentioned in the article. There's nothing to do with that because you know that you are forgetting. A person with dementia will not be able to know that he has forgot. That difference, of course.
Exactly.
Thank you.
Exactly. Yeah, someone else has raised a hand.
Yeah, Minomon. Minomon, can you unmute yourself and ask? Before that, can I ask a question, sir? What is the impact of social interaction in age-friendly environment? Going back to the, like not going to the party,
Okay.
like when the children ask them to.
Before that, can I ask Kirtana to share her thoughts, because her grandfather, if I recollect, was a person who had written several books. He's a literature. Kirtana, can you come in? Kirtana, are you there? Yeah, she was mentioning her grandfather at the age of 75 had written a book. I think that is what I thought was very important for us, because keeping ourselves active socially is a very important component in age friendliness. Now, the issue is also, where do we create these spaces where people can gather? I'm sure those who are from Bangalore will recollect the Bangalore, the Jayanagar 4th block complex. The front area, you could see a lot of elderly sitting there, but nowadays we don't see them. My question is not that place is not suitable now. My question is, where is the alternatives in this whole in this Bengaluru? Is it the temple? Is it any other mall which can come in? But we need to create these environment, the elderly friendly spaces. We need to create these community spaces wherein people can come and sit. In the morning, I was coming through Masti Venkatesh Iyengar Road. That is when I recollect still that I believe he used to walk from Gavipuram till Makkalakuta just to spend some time every day playing cards with his friends. So that is how City Institute came into picture. Now, do we have such places? Now, is our parks a good place for us to re-begin these activities? Fortunately, we have parks in Bangalore. Let's recreate these parks so that we will be able to go and spend time, so that as you rightly said, those social spaces will help us to overcome a lot of things. I know, see, the other issue is also important. Just because someone says something does not mean that we should jump to give a solution to them. As a counselor, madam, I'm sure you will agree with that. Many a times, I would just like to say out what I am feeling rather than wanting a solution from someone else. I have a solution, or I can think of a solution, or I will come out with a solution. But as of now, I want to think through with the problem. Now, that is where friends are for. That is where people whom we can liaison with come up. So, hope I have answered your question there.
Okay, sir. Then any more questions from the attendees?
Yeah, Kirtana, in case you have joined back. Yes, Kirtana, I can see her. Kirtana, can you unmute yourself? Okay, she must be traveling or otherwise. Okay.
So one more question. How to adapt to the urban life for elderly who live in a rural setting?
Okay. Okay, she's messaged something. As sir mentioned, okay, get print off. Madam, could you repeat the question?
How to adapt to the urban life for elderly who lived in rural settings? Like they get migrated to the urban.
Difficult, madam. I wouldn't like to give a prescription saying be very, very, what I would say, dogmatic or paternalistic, and then say you should do only this. Each person is different. Each person will have their way out. There will be periods of stress and distress. They will not be comfortable in several areas. Now, it's over a period of time they get used to what is the environment here. See, it need not be only rural to urban. It's also shifting from a large house to a small house. My parents have gone through that. They were in a 24 square house, now shifted to a 10 square house. Father and mother had got a lot of place to roam around. Now they're not able to maintain that house. They've shifted to a smaller house. Now that's also an issue, and it takes time. See, please don't force yourself. Some things are possible, some things are not possible. Try to identify things which you're more comfortable to do with, so that, as they say, every small success will lead to something bigger. I would hesitate to give a prescription as to how they should be doing it. It's a dynamic process. The family should work towards it. If you recollect, I will just give another example. Many of the elderly people refuse to go abroad to stay with their children or grandchildren, saying that namgen kalsa alli. It's something like same shifting from rural to urban area. If someone shifts from India to, say, Canada, the weather is cold there, people don't come out, sitting in the house. Here, at least they can walk around. They have got their friends. They may not meet them every day, but they have got their agenda here. They can spend time in their own way. Not spend also is there. So in that sense, let's not have a thumb rule. Let's not have a rule per se. Each person is different. Each situation is different. Let's see what is possible, and we are all alive. And I'm sure for them migrating from that place to this place or this place to another place is because of context, is because of circumstances. Let's respect that. Let's give value to that, and then slowly start adjusting. Let's not force ourselves to something. Trying to fit in a small size t-shirt or finally will make the t-shirt toned down. So we should not be doing that. Hope I'm okay with that thought.
Can I interact with this particular point, Doctor?
Yes.
The thing is that I was also living with my parents in a big house with my sister and other friends, etc. Now I have shifted over to a flat. Now shifting it from a big house to a flat is more comfortable after a certain age, I feel, because a lot of facilities are available at your doors. So perhaps this is one of the things that we have I have seen, that people are comfortable more in the flats after age than in the independent houses. Because I'm just suggesting this because I'm the president of the Bangalore Apartment Federation.
Oh, great, sir. No, this is exactly, sir. Nowadays, apartments, especially high-rise apartments, have got a lot of facilities. Now, that is where I'm saying probably we are moving towards that elderly-friendly environment. Let me quickly go back to the screen sharing, which came up. Now, the photos what you saw. This is the photos from Krishna Park, which we started as the senior park. Now, yeah, spending, for example, if you find it difficult to walk across, these apartment complexes will have a common area. Possibly that's where you could also mingle with other people there. And then probably this card game or whatever hobbies which you can, carom, any of those, what you can say, the gyms which are there or the party halls which are there can get converted into reading rooms. Wherever you have a lobby, that's where you can make it more friendly. The point is we should get together to see that these things start happening. Now that's where, as you rightly said, yes, sir, let's make all the apartments age friendly, elderly friendly. We will definitely cooperate with you, collaborate with you, and also support you on that. I think Vayomanasa Sanjeevani, our entire team is there. Let's look at creating such spaces so that things become easier for every one of us, because all of us age at any point of time, and then this is a requirement.
Very true, doctor. Very true. Thank you. I mean, but only one thing is that, see, you have been mentioning about this people moving away from bigger houses to smaller houses, etc. Doctor, what is happening is that this downsizing has to necessarily happen at some time or other. But sometimes what happens, doctor, when people find it very difficult to adjust is that due to circumstances beyond their control, they are uprooted from one setup to another setting. That is where the problem comes, doctor. At that time only, I think this senior-friendly places would be very useful. And we need to create that places, doctor. I mean, what I would suggest is that before an architect plans for an apartment or complex like that, he has to take into account this aspect of life also. Because after all, that person is also going to become a senior one day or another.
Correct. If I can give an example, one of my friends came down from US because his mother was staying here alone. He wanted to spend some time. He had a leave for about 15 days. But when he came back to Bangalore, his mother was more busy than she was earlier. ಬೆಳಿಗ್ಗೆ ಭಜನೆ ಇದಕ್ಕೆ ಹೋಗ್ಬೇಕು, ಮಧ್ಯಾಹ್ನ ಇಲ್ಲಿಗೆ ಹೋಗ್ಬೇಕು, ಸಾಯಂಕಾಲ ಫ್ರೆಂಡ್ಸ್ ಜೊತೆಗೆ ಇರ್ತೀನಿ, ರಾತ್ರಿ ಊಟಕ್ಕೆ ಬಂದ್ಬಿಡು ಮನೆಗೆ ಅಂತ. He was very happy saying that, okay, my mother is now independent, she can manage things, and he went back happy. He didn't get time to spend with her as he had thought, but now he is reassured that yes, she is doing what she wants to do. I think that's what is more important. I think it's also 5 o'clock.
Thank you, doctor. Thank you, doctor, for sharing important points. Thanks, doctor. We are enriched. Thank you for a good advice. Thank you
very much. Sorry if I didn't make it a formal presentation. I didn't want to bore you with the routine stuff which WHO says, which Government of India says. I thought we should speak from our experience and from life. Thank you for cooperating. Special thanks to Dr. Sonali, Revati, Rehan, Kirtana, all of them, because I wanted the youngster to say what is it they talk about elderly friendly community. Thank you one and all. From my side, over to you, madam.
Thank you, sir. Actually, I wanted to second your friend's mother. Like even I am like that, sir. Even my son says the same. Mother, we have to take an appointment from you. You are so busy than us and all. Yeah, that's a way of. I'm 62 years now. I keep myself very busy. So, okay, sir.
Excellent. Doctor, only one thing, just last minute. See, between 60 and 70, things are all okay, doctor. But the problem really comes after 70. 70 to between 70 and 80, people become, that's a total transformation. I think at that point only people start feeling bad.
Sir, your physical abilities get reduced.
Exactly, doctor.
Mental abilities will be the same.
That is agreed. Agreed.
We need to cash in on that. Exactly. We need to realize that physically we will not be able to do that much, but mentally we'll be able to do much more than what we were doing there.
Exactly, doctor. My mind wants me to do something, but my body is not cooperating. That is the situation. And this situation has come to me only after I have reached 70. Now I am 75. Now I am feeling it. Day by day I am feeling it. My wife is also feeling that. That's where the problem comes back. Thank you, doctor. Anyway, you guys were interesting. Thank you. God bless you.
Thank you, doctor.
Okay.
Thank you, Dr. Girish. Really, you have explained how the environment plays a vital role in healthy aging. And also very important inputs were given by your students, doctor. Especially the subject and the safety measures and the changes in the socio-economic changes, how interactiveness and how the family, the environment plays a vital role in aging. And thank you very much, doctor, for your valuable time and also making us enlightened words from you, sir. Thank you very much.
Thank you.
Thank you. I would like to thank Dr. Girish sir and his team for coming for today's session and sharing that wonderful information to us. We welcome you again for another session if you are free, and it will be very grateful for us to see you again in Vayomanasa Sanjeevani's webinar. So thank you so much. With that, I would like to thank all the Zoom and YouTube participants who have joined for today's session. And our moderator for the day, Shakuntala Narendra ma'am, for joining, and all our partners, Karnataka, Government of Karnataka, Karnataka State Legal Service Authority, Bangalore Apartment Federation, Happy 60 Plus, Samadhana Counseling Center, Indian Psychiatric Society Karnataka Chapter 1, Icon Life Science, REC Foundation, and NSC Foundation. Once again, thank you all for joining today's session. Have a wonderful evening.
Thank you, Gina. Thank you, sir.